Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, let me introduce myself first. My name is Syifa Rohana. I am from class G. On this occasion, I would like to present my project presentation. This project is an innovation created with the aim of making it easier for patients to get health services in the midst of a pandemic. The concept of this project is that patients will get an examination from a doctor without having to get off the car or enter the hospital. Why should we realize this project? As we know, new cases of corona in Indonesia have not shown signs of decline. Even today, the addition of new corona cases is back above 6,000. The high number of additional positive cases of corona has resulted in the government asking the public to have a high and collective responsibility in complying with health protocols. The health service is no exception. Even though the patient is undergoing an examination that requires physical contact with a doctor, part of them must still adhere to health protocols that have been set, like wearing a mask and washing hands frequently. However, without realizing it, sometimes this service can lead to accumulation of patients and even crowds. So, to keep a distance from each other, I think this is quite difficult to avoid. Therefore, there is a need for a new breakthrough in the world of health. This breakthrough is called health services by car. Then what needs to be prepared by the hospital when this project is running? The hospital will prepare a tent for medical personnel, all medical equipment, and also a large yard for queuing for patients' cars. This service is open during office hours as usual, but the inspection is carried out outside the room. The way this project works is first, the patient registers online before coming to the hospital. This can be done via the WhatsApp application or email. Then the hospital will provide a queue number and determine the time when the patient can be taken to the hospital for examination. Second, doctor and nurses will examine the patients who are in the car through the window or door. Health workers will strictly maintain health protocols by wearing full medical clothes, so it makes patients feel safe. And the last, regarding drug collection and payment, this will also be done at the same place directly after the examination. However, if there are patients with serious illness who need more medical equipment, I suggest that health services should be shifted to hospitals. Based on the analysis that has been estimated, this will have a very good impact on the hospital, medical staff, and patients. As a result, patients will still get the best health care safely. Likewise for medical personnel, for doctors and nurses. They can also examine patients quickly without worrying about crowds. The conclusion is that if the Health Service Project through a core can be realized and runs well, then the transmission of the hospital cluster virus can be minimized, and we can reduce the number of additional positive cases in Indonesia. Okay everyone, I think that's enough for my presentation. I hope this project can be realized as expected. Thanks for your attention. Wassalamualaikum warahmatullahi wabarakatuh.